Let's talk aging and disease in the integumentary system. Now, first, let me just say it was pajama day, spirit week at school, and quite frankly, you just get graced with this lovely pajama outfit for this video. So, as a reminder, homeostasis is maintaining that stable internal environment, even when the outside environment or the inside environment changes. So what does it mean when there's disease? Well, that means there's a failure of homeostasis. Symptoms are subjective. So a person experiences the thing and describes them, but it's not measurable. So pain, anxiety, nausea, dizziness doesn't mean it's not real. It just means it can't be measured. A sign, on the other hand, is objective, and that's a physical indicator of disease. I can measure it, observe it, verify it. So a rash, swelling, fever, wheezing, I can listen, I can hear heart rate, high blood pressure. Technology reveals a lot of additional signs, anything that can be done with a blood test or an X-ray or an MRI or an ultrasound. And then we have inflammation, our signs and symptoms of inflammation, and regeneration. And hopefully in regeneration, it's a restoration of homeostasis. And those signs and symptoms of inflammation, remember PRISH, pain, redness, immobility, swelling, heat, right? Immobility, the same as loss of function. So just a quick recap of the integumentary system that includes your skin, hair, nails, and glands. It is a barrier to protect you from the outside world. It retains our body fluids. It protects against disease. It eliminates some waste products, and it helps to regulate our body temperature. So let's talk about how aging affects our skin. Well, skin injuries are more common. The epidermis thins because stem cell activity declines. Less vitamin D is produced, and that means the bones are weaker and muscles are weaker because calcium and phosphate absorption decline. Sensitivity to sun exposure increases because melanocyte activity decreases. There's less melanin. So you're noticing a trend, right? Everything slows down, gets thinner, more brittle as we age. Skin and hair color change. Again, less melanin, less melanocyte activity. Hair thins, the follicles stop functioning or they decrease in size, which results in thinning hair. The skin gets more dry and scaly because our sebaceous glands are less active. There's less thermoregulation. The sweat glands are less active. We're less able to dilate and constrict vessels because the blood vessels are less stretchy. We get wrinkles and saggy skin. That's because our dermis thins, there's less blood flow, and we lose some collagen and elastin in the dermis, specifically of our skin. So here you can see the difference between young and old. We have breakdown of those collagen and elastin fibers in the dermis, as well as it getting thinner. So as we age, there are a lot of changes to the skin, but overall it's thinning, getting wrinkles. So what are some ways the integumentary system is affected by aging? You should know a bunch now. All right, now we are talking about skin cancer in this storyline, so let's revisit skin cancer. Skin cancer is the most common type of cancer. 40% of all cancers diagnosed every year will be skin cancer. So what is cancer anyway? Well, it's uncontrolled cell growth. It's caused by damage to DNA. So You may have heard these words before, benign and malignant, but you may not know what they mean. If something is benign, it's typically a small, slow-growing mass of cells, but it's localized, so it can be removed. It hasn't spread anywhere. And when something is called malignant, it means it has metastasized. It has spread. It is no longer contained in one spot. It has spread to other areas of the body. So for example, it started as a tumor in the stomach, and now it has spread and it's in a lymph node or it's in the liver. Okay, that's a sign of malignancy. And benign is easier to treat and recover from than malignant. So let's talk about UV radiation related to skin cancer, right? The main cause of skin cancer is UV radiation. We have UVB radiation. That's the burning rays. They can promote cancer and aging. And then we have UVA rays, which penetrate deeper into our skin. They are tanning rays, and they promote wrinkling and aging and can also promote cancer. Okay, we have basal cell carcinoma. It is the most common type of cancer. 80% of skin cancers diagnosed will be basal cell carcinoma. It begins in that stratum basale and has a 99% cure rate if it's caught early. Squamous cell carcinoma, this begins in that stratum spinosum layer. It's more common in darker skinned people, and it does account for around 1,500 to 2,000 deaths every year. And then malignant melanoma. It is the least common. It begins in melanocytes in that stratum basale. It is the most deadly type of cancer. It does have a very high cure rate if it's caught early, but this one is less likely to be caught early and more likely to have metastasized. Remember, that means it becomes malignant, okay, and then it becomes more deadly. So when should you be concerned about something that you find on your skin? Follow the ABCDEs. Okay. First of all, it's just a good idea to get checked yearly by a dermatologist, but the ABCDs can help. A, asymmetry. Is it the same on one side as the other? Okay. B, border. Look at the border. Is it even? Is it uneven? Has it changed? C, color. Is it dark? Does it have multiple colors? Has it changed in color? D, diameter. Is it greater than 6 millimeters? And you may say, what the heck is 6 millimeters? A pencil eraser. So take a pencil, put it on. Is it greater than a pencil eraser? And E, evolving. Is it changing? Did it change in size? Did it change in shape? Did it change in color? Those are potential red flags. Now, there are issues in skin diagnoses in people of color. So skin cancer in Asians. The most common sign of skin cancer in Asians is often this roundish, raised brown or black group. It can also show up in other ways, so check skin carefully, but it does appear differently in people of Asian descent. Now, skin cancer in African Americans, it often develops on parts of the body that get less sun, like the bottom of the foot, the lower leg, the palms, even underneath the nails, around the anus, or on the genitals. So you have to be careful. If we're talking about Latino, skin cancer can appear again in many ways. If you have a growth on your skin that's bigger, a patch that's scaly, a dark streak under a nail, make an appointment to see a dermatologist. Okay, so it's not always the same for different races. The estimated 5-year melanoma survival rate for Black patients is 71%, 94% for white patients. So there's something. There's a lack of access to health care. There's maybe a lack of health insurance. Whatever the issue is, there's some disproportionate survival rates. In the past 2 decades, melanoma incidence has risen by 20% among Hispanics. And Bob Marley, he had melanoma, and it's the reason that he died young. The most common type of skin cancer is basal cell carcinoma. Right, let's talk a little bit about acne. So what is acne? Well, a sebaceous duct becomes blocked. The secretions, that sebum, is trapped and it accumulates. It causes inflammation. Signs and symptoms of inflammation, what are they? Prish, right? Pain, redness, loss of function, swelling, and heat, right? It can lead to a bacterial infection. It's not always, okay? So again, remember the signs and symptoms of inflammation. Remember the acronym PRISH, right? So we could have blackheads. Blackheads look like a black spot. So a pore gets blocked. Sebum and skin cells are what typically ends up blocking it, but the pore is open to the air, so oxidation occurs. So that sebum gets discolored black. Whitehead, essentially the same thing, except the pore gets blocked with sebum and dead skin, but the pore remains closed. So it's trapped underneath, so no oxidation. So it looks just flesh colored, maybe whitish. You could have pustules, which you might normally think of as pimples, right? Contains fluid or pus. Looks like large white bumps surrounded by that inflamed skin. This is often caused by bacterial growth, okay? Now let's address some other things. We have psoriasis. Now, psoriasis is a chronic inflammatory skin disorder. It has these silvery, scaly lesions. It's itchy. The treatment, well, we could use ointments and some anti-inflammatory. This is not acne. This is another type of integumentary system disorder. There's also eczema or atopic dermatitis. It is inflammation of the skin. So you get a rash. It's caused by contact with an allergen or an irritant. And the treatment, again, is usually an ointment, a cold compress. You may try to figure out what caused the reaction, and avoiding it is often helpful. So let's go through a few other problems of the integumentary system. One is vitiligo. Vitiligo is the loss of skin color in blotches. Why does this occur? Cells that produce melanin die or just stop functioning. So the melanocytes die or stop functioning, less melanin is produced, results in vitiligo. Athlete's foot, or tinea pedis, like think foot pedal, right? It is a fungal infection. It's a scaly rash. It itches, it burns, it stings. It is contagious, like really contagious. You should always wear like shower shoes if you're somewhere you don't know. The treatment is antifungal medications and trying to keep your feet dry, okay? So again, athlete's foot, it favors damp conditions, so keeping your feet dry really helps, okay? It's the same fungus that causes ringworm and jock itch. It's just on your feet. All right, then we have warts. Warts are really common, caused by a virus. It is very contagious again. It can spread from skin to skin, so from one part of you to another part of you or to other people. And it can be spread from skin to skin or through contaminated surfaces, again, wearing shower shoes in unknown situations. It's most common on fingers, hands, and feet. Treatment over-the-counter medications. You can do surgery, have lasers, freezing, burning. There's lots of different treatments for warts. Again, super common. It's caused by HPV, human papillomavirus. There are versions of this that cause cervical cancer. This is not one. And sometimes the warts reappear, so it's something that may need multiple treatments. We have hives or urticaria, and that's a skin rash that's triggered by an allergic response. It causes itchy, raised welts. The treatment is Benadryl, anti-itch ointments, sometimes steroids. And you may notice I've been showing a lot of images that have different types of skin tones, because part of the issue in the medical community is that sometimes we are not paying attention to the fact that different conditions look differently on different skin colors. So you can see that hives or urticaria may look completely different on someone with more melanin in their skin than someone with less melanin. And we need medical professionals who are well aware of these differences and have training in identifying different conditions, no matter what someone's skin tone is. All right, we have herpes zoster. That's shingles. It is a painful, blistery rash along a nerve pathway. It's often also tingly. Treatment, antiviral medication, pain medication. There is a vaccine for prevention. It's good for people who are over the age of 50. Again, remembering it looks different on people with different skin tones, and we need medical professionals who are educated about that. Okay? It's caused by the same virus, herpes zoster shingles, that causes chickenpox. Right, rosacea. It is redness. It's visible blood vessels on the face. One of the possible causes, now it has not been solidified as a definite, but one possible cause is too many face mites. Remember, if there's an overgrowth, it can cause a red rash on your face. Normally, our immune system keeps those face mites in check, but rosacea is something that may develop when there's an imbalance. There are different types of birthmarks. It's an irregularity on the skin that shows up at birth or really shortly afterward. It's often caused by an overgrowth of one cell or tissue type. So it could be a blood vessel, a melanocyte, a smooth muscle, okay, something overgrew. So there are a lot of different types. Most are harmless. Okay, again, a variety of different types of birthmarks. Then we have albinism. This is an inherited disorder, little to no melanin production. It comes with an increased risk of skin cancer, and they often have eye problems, and that's related to the change in the pigment in the eye. Impetigo. Impetigo is a skin infection. It's super common in children. You get kind of these red sores around your mouth and nose, super contagious. Treatment is antibiotics. You could have an ingrown nail, okay? So that's where the side of a toenail or a fingernail grows into the skin. It will show with signs of inflammation, pain, redness, swelling. Usually when it's on the feet, it's the hallux. Causes: wearing tight shoes, cutting your toenails too short or not straight across, so trying to cut at an angle. So that is one of the causes. And possibly injuring your toenail. All right, thrush. Thrush is a fungal infection in the mouth and throat. You get these white lesions on the tongue and inside the cheeks. It's common after a round of antibiotics, so then there's an overgrowth in the mouth as a result. Treatment is yogurt, which has some good bacteria, or antifungal medication. In addition to having an ingrown nail, you can have an ingrown hair. And this is where a shaved or tweezed hair grows back into the skin. Inflammation, pain again. It's more common in Black men who shave their facial hair because the hair is typically curly and it curls right back down and gets under the skin. Herpes simplex, HSV1, blistering sores. It's spread through kissing, sharing utensils, lip balm. The treatment is really to limit outbreaks with medication. And this can be spread to the genitals. Like, this is technically oral herpes, but it doesn't know it's oral herpes. So it could be spread to the genitals. Okay. Stretch marks. Stretch marks happen when the elastin fibers in the dermis stretch so much that they tear. So it occurs with rapid weight gain and growth. So that's pregnancy, puberty, also happens in bodybuilders. They're typically pink or bluish at first, and then they fade to these like silvery white scars. Can also have split ends. That's where the cuticle, that outer covering on the hair, flakes off and the cortex frays out. Our last one, are you ready? Cellulite. Cellulite happens when collagen loses strength. So fat gets squeezed in between connective tissue, connects the dermis to muscle. And almost no penis owners are affected by cellulite, but 90% of uterus owners are. So if you are a person who owns a uterus, most likely you're going to have cellulite. It's just a part of being who you are. So, and some people have it worse than other people, okay? And it often gets worse as you get older, but it's just part of who you are, unfortunately, if you have a uterus. So nothing to be ashamed of. A lot of people feel some type of way about the cellulite, but it's just part of who you are. Okay. That was a whole lot about the integumentary system, but I hope you learned something interesting.